In the beginning, our idea and thought process was focused on, okay, what do we need to do in order to secure our patients? Do we need to evacuate? Do we need to start thinking through the checklists and the plans of how we will best protect our patients, our staff, and any of the visitors that might be here with us as the storm comes through?
The interesting thing was, as the week started to progress, the storm started tracking differently. Not that it wasn't going to hit North Carolina hard, but what we would need to focus on from a hospital perspective that did start to change.
So there was a lot of things that were happening initially that was of concern, because how are we going to, if we send a lot of folks down initially, how are we going to manage things here if we got hit really hard?
The emergency managers at Duke University Hospital, this was their first storm that they ever went through. It was the first storm or major event, really, that the emergency manager at Duke Raleigh went through. The leader of our SMAT team, David, started
September 4th, and September 9th we were in hurricane mode.
From a statewide perspective, what were we going to be asked to do to help support the state?
So we started reaching out to see what we could do to start gathering folks, because the state had requested that we set up a state medical support shelter.
When the request came for volunteers for serving through the Duke Disaster Preparedness Team for Florence, I had a pharmacy resident with me this month training, and asked her if she wanted to go with me. She did, so we both signed up to go, so it was 2 pharmacists.
Where SMAT was getting ready to deploy down to Goldsboro, North Carolina, to the old Cherry Hospital.
When I say that it was a vacant hospital, it truly was a vacant hospital. Nobody had been working there.
Things that we had to do when we arrived at Cherry Hospital, given the fact that it was a facility that had been closed. So not only were you trying to take care of patients as they arrived or residents as they arrived, you also had to clean the facility.
We figured out everything from facilities to food to medical care to discharge planning to all the psychosocial needs without a hiccup. Everyone just pitched in. It was the best teamwork I've ever seen.
It was clear that we had a few critical patients who needed to leave the coast, and the only means of transportation was going to be a helicopter. We partnered with the Coast Guard. We had people stepping up on that Saturday night in the midst of the storm saying, if a Coast Guard helicopter can get here, I will get on that helicopter in the storm. And we actually had the Coast Guard fly in, pick up some of our medical crew and supplies that was needed for the coast.
We just jumped into the chaos. We saw the things that needed to be done through the pharmacy lens. Patients needed their meds, and so we went about helping to get them.
And we still wanted to be able to provide the same level of care in a facility that had been closed, as which we were trying to provide in the facility which we have here.
This was different. This was kind of a once-in-a-lifetime opportunity to really make a change, really be part of making someone's bad day into a better experience.
The teamwork there really stands out, but also just the patients. The patients there were very grateful for the care that they received.
Many of them knew that their homes had completely been submerged by this point, and that life was going to be something different. Yet they did not allow their circumstances to change their kindness, their humility, the type of people that they were.
Because we could see that some of the morale was waning.
They decided with their own money they were going to go out and buy ice cream. And they threw an ice cream party.
The ice cream social idea came from nursing staff, and it was completely planned by the Duke nursing staff. The patients had decorations, they had ice cream, they had music.
It was just another step above and beyond, or what anyone would normally do, of providing care.
To be a part of a team from Duke that was really committed to taking care of our patients, whether it was part of our day-to-day responsibilities that we do back home, or whether it is going into our community and serving patients during a disaster. To be a part of an organization that supports us in doing that, it just really makes you feel good about yourself and for who you work.
I hope that we don't ever have to deploy for a large hurricane, but if we do, I'll be glad to go with any of them. I know that they'll make a difference wherever they are.
These Duke staff members walked into a building, they turned it into a fully functioning, we call it a shelter, but in reality it was a hospital.
We took a group of nurses who don't normally work together. We took a federal team that was there to support our team, the Duke team, and then a group from Florida who were ambulance transport team, and we worked seamlessly.
Some of the patients that I got to talk to, they said, I normally wouldn't travel for my care. After the Angels, you sent us down here to be in the shelter, we would drive to Duke to receive care.
It feels good to know that the response that we put together helped people. It feels great.
This response truly hits on all the different values that we have from a Duke perspective. And it was just really amazing to see all of those in action in one single event.